Hello, and welcome to Inside Cottonwood. I'm your host, Doug Bartosh, and I'm here today with a couple of health educators from the County Health Services, Kristin Robertson and Stephen Elston.
Correct.
Now, do you prefer Steve or Stephen?
Mostly Stephen. Thank you very much.
Mostly Stephen. Okay. And we're here today to talk about prescription drug abuse. And that certainly has become an epidemic across the country. And I know the federal government has invested grant dollars in trying to come up with some prevention and treatment approaches. But I think it's important to look at what are we doing here locally in Yavapai County. And so let's start off with Kristin and find out, how did this happen? Where did this problem come from, and why has it become such an epidemic?
Okay, so it is considered a national health crisis. Stephen actually has a better handle on the history of how this came about, if you don't mind taking that one.
Let's turn to Stephen.
Use of medication and morphine's been around for a while. The U.S. has had a pretty interesting history with that. It wasn't until about 1920, 1930s that a grander look at substance abuse came into play with prescription medication. And so taking a look at opioids in specific, there is a big withdrawal from prescribing it to people all across the nation. And then around the 80s and 90s, Percocet, Vicodin, OxyContin came into play, and there was a big push to reintroduce the distribution of pain medication to people. And it wasn't just, if you're shot or had a really serious injury, it was, back pain, sometimes even chronic pain, distribution of medication from prescribers. And so what that did was allow a larger audience to have, a hold on this drug. And now recently we're seeing some of the effects of overprescribing and misprescribing and the abuse from which it was caused, 20, 30 years ago.
And I think a lot of times people lose that perspective that this is morphine. I mean, the same stuff that is, used to make heroin, and it's extremely addictive. And so it does need to be closely monitored. And we've had conversations with hospitals and those kind of things, and it seemed like there was a real push in terms of rating hospitals at how well they worked with patients, and one of those criteria had to do with pain. Did you help them in terms of their feelings of pain and those kind of things? So there was that tendency to, if anybody walked in, it seemed like, and said, I'm in pain, they would give them a prescription, they'd go fill it. And so it seems like that kind of created that epidemic as well, as everybody thought it was the answer to pain. And so consequently, nobody looked at the other side of pain if you continue to take this, which is addiction. And so it really has created some issues with that.
Yeah, and right. we're looking forward now, especially as a state, but in county specific, of how to tackle these issues. And so for us as the Community Health Services, we were able to get a larger grant to kind of tackle a couple different strategies, and one being the distribution. So speaking with prescribers and physicians on how to sign up to what's called the prescription monitoring database, which has been around for a while. In fact, in close to a year from now, it should be mandatory to sign up, but sooner the better. And so part of what we do is speaking with prescribers and getting the sign up. And a larger part of that strategy too is approaching pharmacies with and the community with understanding warning signs of addiction, where to dispose your medications to get it out of the hands, especially kids. Yavapai County, we have a little bit of an older population here, and it's not uncommon to see lots of pills over the years getting collected into medicine cabinets and different areas of the house. And just because of that sheer amount in the households, kids can certainly get a hold of it. Experimentation happens, and because we know that opioids are so dangerous to our health, and even mixing drugs like benzodiazepines with opioids can be deadly, and we see that in our county.
Yeah, 4 times deadlier, those two combos together.
And when you use kind of the technical term, define for the audience what a diazepam is.
Sure. So
The common names for it.
it's, well, benzodiazepam, you hear that all the time, but it's basically a muscle relaxant. And so if you think about something like an opioid and what it does to our brains, and it attaches to our opioid receptors, and it kind of depresses our heart rate. It slows our breathing, and you mix that with a muscle relaxant, that can actually take you into levels of overdose to where your heart slows down so much that it can't actually pump blood up to your brain, and it can cause some serious mental issues, and then of course death from overdose.
And it's certainly not only muscle relaxers, but we've seen that happen with alcohol.
Correct.
Which depresses your central nervous system, and when you begin to mix those, there's that synergistic effect.
Right.
Where
the cocktail.
Yeah.
Yep.
Where you just stop breathing and die. And unfortunately, it seems like the demographics have kind of changed with prescription drug abuse as well. And so, what are you guys seeing in terms of the demographics related to prescription drug abuse?
Yeah, so the demographics, so from the numbers are kind of from 1999 to 2014. That's what we have a good grasp on. And 165,000 people have died of overdose from opioids since then. And that's 78 people per day, and every 19 minutes, which is 3 per hour. And back to the demographics, it's affecting mostly white, non-Hispanic males from the ages of 25 to up to 54. And that amount is closely followed by a rapidly growing trend of middle-aged white females. And those demographics have quadrupled 400% in that time. So the numbers are rising and not falling still. We do have preliminary death results from 2015, and it was pretty shocking because acute drug overdose, including opioid overdose, actually surpassed death rates from vehicular accidents.
Is that nationally, or is that here?
Actually, the national trend is following that. It's not quite there yet, but in Arizona it did. Okay. It did come up and over vehicular accidents. So.
And when you say opioid overdoses, it's not just prescription drugs then? You're
Correct.
Talking about heroin as well.
I am, yeah, we are talking about heroin as well. The CDC is saying that 6 out of 10 deaths from opioid overdose are from prescriptions, so over half are prescriptions, which is, it's disturbing because people think that there's safety in prescription drugs and that heroin is the scary one,
right,
when really more deaths are coming from prescription drugs.
Well, and you know, I think the other phenomena that has occurred is it seems like as we tighten up on prescription drugs across the nation, obviously that makes them harder to get.
Right.
And so heroin's the alternative.
Right.
And it really is, yeah, a much cheaper alternative as well. So.
And it would seem to be a very, very scary alternative. I certainly wouldn't want to go down that road, but the addiction is so strong that family ties and job responsibilities and everything goes out the window for the power of that addiction. And they will start injecting. 91% of heroin users were first addicted to prescription medication. So.
You know, and I think the other thing is, as the demographics kind of display, I think a lot of people equate this to any other, you know, drug abuser. Is, you know, it's somebody who's on the street or, you know,
right.
Lives a life of crime and is outside, I guess, what you would call norm
right.
of our society.
And this epidemic has blown that up. It's in every socioeconomic level that there is, unfortunately.
You know, and it's interesting too because and you guys can probably talk about this a little bit, but you know, there's this phenomena where you begin to build a tolerance for pain medications, and right. So consequently you end up taking more and more to
right.
treat the same level of pain that you started with. And
that's right, and that's where the overdose often comes in, especially if they take a break, whether it's forced by a jail term prison or something, they take a break away from that and come back to the dose they were used to. You know, body's not used to that high level anymore, and
they take the same level that they were using when they went away and come back and start that same level. And
right, and then back to the benzodiazepine. Let's say Xanax is the most well-known one. So if somebody's taking Xanax and hydrocodone together, yeah, their risk of death is 4 times greater from that anti-anxiety. So, you know, these are widely prescribed drugs, one for chronic pain, let's say, or acute pain or post-operative pain. And then if you, let's say you've been taking an anti-anxiety for years, the two together, big problem. So.
Let's go ahead and take our first break, and then we'll come back and kind of talk about the strategies that you guys are looking at employing. Come back and join us.
Gabby, how you doing? How's the play date and sleepover?
Dad, it was great.
Awesome. Okay, I'm on my way. Hey guys, what are you doing?
We're going swimming. We're going biking. Yeah!
I'll see you in a little bit, guys. I love you.
Hi, babe. How was school today?
Hi, Dad. It was great.
Okay, honey. I'll be home soon. Remember, you're never too far away from your kids to be a dad. Reach out and take a second to check in, because sometimes the smallest moments can have the biggest impact on a child's life.
Welcome back to Inside Cottonwood. I'm your host, Doug Bartosh, and we're here today with Kristin Robertson from and Steve Elston from County Health and their community educators. And we're talking about prescription drugs and the abuse of prescription drugs, and how that there's a trend where that's leading into heroin use and drug overdoses and a high level of death across the state and across the nation. And so what they're trying to do is get out and educate people, put in place prevention programs that hopefully lower the amount of abuse out there. So we talked a little bit about the prescription drug monitoring program that is basically run by the State Pharmacy Board, I believe. And so talk about how that works and why that's important.
So how it works is currently doctors, physicians, prescribers can sign up for this database, and what it tracks is different classifications of drugs, more specific to opioids, because of the recent abuse of that. And what it can let these prescribers do is compare themselves to others in the state. Other states do have their own separate programs. We have our very specific Arizona database, and every so often these prescribers will be given a report card that'll have different graphs and charts letting them know, you know, it seems as though you're over prescribing. There may be an issue. What are you describing? Who's your clientele, to allow them to kind of assess their own situation if they do happen to be over prescribing. There are some, well, first off, veterinarians won't be a part of this, but we know that there's still abuse within the veterinarian world as far as opioids being given to their pets. Even abuse of kind of larger, more synthetic opioids too with animals are being abused. But that program is really just to kind of give a greater awareness to decrease the amount of prescription drugs out there.
You know, and I obviously have some history with this, with MadForce, but you know, it seems, as I recall, probably about 4 years back, the percentage of physicians using the PDMP was about 11%. Mm-hmm. And that has improved. but we want to see that improve even more because it prevents what we commonly refer to as doctor shopping.
Right, and it does become mandatory by this coming
Yeah,
October.
talk a little bit about that legislation.
Yeah, so this coming October 2017, it will be mandatory. For physicians such as veterinarians, they can voluntarily go in, if they have a patient that's requesting an opioid for their pet or a benzodiazepine for their pet, they can go in there voluntarily and check out that patient and make sure, or that pet owner, and make sure that they're not in the database with a red flag. And then all the other ones that are mandatory to report will be checking that, and then the pharmacies too. So it's just going to be, the numbers are going to be 100% by next year. So.
You know, when we talk about vets, I mean, obviously we're not talking about pets going out and abusing these substances. It's the owners who you know, find that they are pills that they can take as well and abuse them. And, and quite honestly, they may shop veterinarians as well.
Correct.
So.
And we've gone into offices that have told us, oh yeah, we have patients that try.
Yeah. So, so it's really great that the legislation has come through, and I think that'll help a lot as well. And you know, I got to give a plug to a guy who I work with pretty frequently, who was really the motivator behind that legislation. And I don't know if you guys have met Dr. Catalico.
Oh yes, he's famous.
He's very present.
Yeah, yeah.
He's awesome.
But he was the guy who pushed for that, and
yeah.
and you know, thankfully the legislature saw the wisdom in that and got it through.
Absolutely.
So again, there's some other exciting legislation that's coming out related to naloxone. And, you know, talk a little bit about that, Stephen, and the importance of that.
Sure. So in regards to prescription drug overdose, opioid overdose, naloxone is quite an incredible drug. It's been out for quite a while, but Arizona State has just made it legal for doctors to prescribe lay people naloxone. And what naloxone is basically an opioid antagonist. So if you know, those of us in the room, let's say we don't have any opioids in our system. If we were to take, you know, intramuscular naloxone, or they even make it in a nasal spray now, it would have no effect on us because we don't have opioids in our system. If somebody were to have taken too much opioids and are in a state of overdose, this would allow someone, you know, a friend, a family member, to have that in their kitchen or wherever to take it out and basically deliver naloxone in the system. It tears the opioid out from the receptor, and it basically gets them back into an operating state. Sometimes, though, especially that we've seen some new cases of more synthetic versions and more powerful, like fentanyl and carfentanil. Each kit should usually come with two doses of naloxone, because even though it might bring them back to a healthy state, you know, it's gotten rid of the opioid, it can come back. And so, I mean, we keep chasing these better ways to try to combat overdose. But this will allow people at a cost to have access to naloxone, and I think that's a huge deal for Arizona.
You know, and I think this is a great program, and I think that the caution we always want to give people who may be in a situation where they have to administer naloxone to somebody, it doesn't mean you don't call for emergency services to come
you
help.
still call.
You still call.
Yeah.
And the reality is the patient may come out kind of in a violent way.
Correct,
so,
and they can often re-overdose.
Yeah, so it's important to even if you use naloxone, to get emergency help out there.
Absolutely, and the Good Samaritan laws cover going for help.
Yeah.
They're not going to face any repercussions for going in and getting turned around medically.
The intent behind the legislation is really to save lives, not prosecute people. So,
Right.
So, what strategies are you looking at kind of specifically to try and reduce the abuse of prescription drugs and opioids?
We have pretty specific strategies that we mentioned before with talking to prescribers. But that is not, that's just one piece of the puzzle. We also support others that are, tackling different issues. For instance, we were talking about, Matt Force, and they've been doing this for much longer than us, trying to get the pills out of reach and out of the hands and finding alternatives. We've been working with even inner departments, trying to get on board with what's called CDSMP, which is Chronic Disease Self-Management Program, as an additional tool to assist people who may be going through pain. And Kristin and I are trying to focus a little bit more on the pain side, pain self-management program with that. There's other great organizations that are understanding the trends, like we mentioned before, that if you take out prescription drugs from the drug market, even the illicit drug market, you're going to see somebody change. They're always going to be looking for that same sort of addiction, which was heroin. And so people are noticing that and really trying to keep focus on things like bloodborne pathogens. Organizations have come back within Yavapai County with numbers like, about 58% of people who have HIV or hepatitis have used injection drugs in the past, 12 months. And 88% of that shared needles. So now we have a whole, because of this tackling different drug issues, we have issues of, that I am sure are going to go up, with this current drug trend, and that it is an injectable drug of HIV and hepatitis C. So it's kind of an ongoing big issue, but to keep comprehensive thinking to it, to understand that we can tackle this, you can tackle that. Let's put a little bit more thought into it than like we saw in the 70s, thinking that, oh, it's just the minority is the group, then we don't think about it. Now we're forced to think about it.
Well, and I think you're absolutely right, Stephen, because the more resources, the better, and you can't look at these things as kind of from one portal. It can't be just, education, or it can't be just prevention, or it can't be just treatment, or it can't be interdiction. It seems like it's really got to be all of those to try and make an impact. So
Absolutely.
Anyway, let's take our next break, and we're going to come back. I want to talk a little bit more about the pain management program, and also want to talk about a new drug that I got some information on the other day to see if you guys know about it, and because it was pretty scary. So anyway, come back and join us.
Todd's a great guy. Look at him. What a sweetheart. Attaboy. Wait, Todd, what are you doing? How totally selfish and un-Todd-like of you. Come on, Todd. Come on, man.
Welcome back to Inside Cottonwood. I'm your host, Doug Bartosh, and I'm here today with Kristin Robertson and Stephen Elston, and we're talking about opioid abuse. And Kristin just came up with a statistic, which I think is important for our viewers to hear about. What is that statistic?
Oh, we were just talking about how of all the people that are prescribed opioids, 1 in 4 struggle with addiction issues with that. So.
And again, it's not people who necessarily go out looking for a high.
Right.
I know two parents that I met that their daughter was very invested in sports, good kid, never got in trouble, had to have knee surgery. And the knee surgery didn't go real well, and initially she was prescribed pain medication, and then had to have additional knee work done. and the pain medication just kept coming and kept coming, and she developed an addiction.
Right.
To the point where she eventually ended up overdosing. And again, so this wasn't somebody who was looking for that high.
Not recreational.
They were looking to deal with
Medicinal.
that pain, and they just couldn't get enough to deal with the pain.
How old was she?
I want to say she was still in her teens.
Right, and so now the latest push is to try to hold off on prescribing any opioids for anyone under age 18. That's one of the components of this prescribing guidelines that the CDC and the Department of Health are coming out with for physicians. So yeah, we don't want minors to have too much of it. Of course, post-operative. We're not talking. Serious pain needs serious meds.
Right.
But,
Absolutely.
But just for a short time.
Yeah.
And then other things other analgesics need to come into play. So
Well, and I guess fortunately we've all been educated on how addictive these pain medications can be, but a lot of people don't understand that, and so I know when I've had surgeries, I really I try to avoid taking the pain medication.
Me
I mean,
too.
I don't want to be in discomfort, but then again, I just don't want to take it at the drop of a hat.
Right.
So what are the things that people can do to kind of alleviate pain or manage pain without always turning to a pill, and opioids in particular?
So from when we talk about our own surgeries, I've had C-section and I've been prescribed opioids too, and I feel very lucky that I didn't like the narcotic sedative effect. So I probably, like you, quickly switched over to ibuprofen and Tylenol.
Right.
And then now cognitive behavior therapy is coming up as this actually helps. In here it talks about antidepressants surprisingly helping with that rather than benzodiazepines and opioids. There are a lot of there's a whole slew of treatment options besides opioids. But again, we're not talking about somebody with cancer or terminal illness.
Right.
you know.
Yeah. So when you say, I think it was cognitive behavior, what does that mean? Describe what that,
So
how that works.
And I'm not a psychotherapist or anything, but the way I understand it is it's focusing on how powerful our minds are to overcome feelings of pain, focusing on doing things that make us happy, the pleasure receptors that opioids also hit. So filling the pleasure receptors with things that make us happy, whether it's riding motorcycles or whatever brings us joy, and, and just tackling it with real solutions like that, and just concentrating on the good.
Yeah. And I think we probably all face pain at some time in our life, and it seems like as you get older, you face more pain more often. And so you do have to learn how to deal with it, and it's not always by taking a pill.
Right. We don't want to take it for every inconvenience or every minor pain, just like we wouldn't want to take antibiotics for a sniffle,
The other thing is we talked just briefly about, I saw this new drug, as we've talked about, and certainly we've seen in some nationally recognized figures across the country who mixed heroin with fentanyl.
Right.
I think Prince.
John Belushi, Elvis back in the day.
Yeah, and
died from opioid overdose.
who was the other? Hoffman.
It's Philip Seymour.
Philip Seymour Hoffman.
Yes.
I mean, and so that's again that cocktail of stuff that people take that seems to lead to overdose as well.
Right.
I think too a big part of it too, because now that we're on the topic of celebrity, and we've talked about teens taking it, those who seemingly are not susceptible to addiction or to overdose. I think the biggest part now is for community like Yavapai County to understand stigma, and that it's a powerful drug. The drug doesn't care who you are or how much you take. It's up to us to kind of say, look, it can be anyone at this point, and we don't know what these drugs are. Illicit drugs too. I mean, like you mentioned before, there's new synthetic opioids that can be made, at home, and to realize that and understand it, and kind of invite that as a conversation to especially parents, but to anywhere from kids to the elderly needs to understand how it affects our body and the stigma that it currently has, to kind of crash that and create a new environment that invites education into the home.
We're just about out of time, but I think it's important before we leave, real quick, whether it's a young person or an adult, if you're a loved one of that person or a friend, what do you look for? How do you know that they may be possibly abusing
There are
opioids?
definitely shifts in patterns of behavior, inability to perform responsibilities such as school, jobs, the role in the family, making excuses for a lot of legal involvements. Do you have any more?
No, I mean, it can be, the reason why people use drugs is it's everything, it's environments, it's recreation, it's who they are, it could be the drug itself. So just having an open mind about, the concerns that everyone deals with, it can be an issue for abuse.
Yeah, the
And
pain
usually-
is real too that brought him on.
Yeah.
And usually somebody who's close to them knows something's wrong, and
Right.
either they don't want to mention it or they don't feel like they're sure. But it's always a good opportunity to open up a conversation with your loved one and say, "Hey, can I help you?"
Exactly.
Real quick, anybody who wants more information, where do they go to?
We have YavapaiHealth.com.
Okay.
And in there's a healthy living section, and people can actually take a workshop with us for 6 weeks. It's free, and it can address alternative ways of all kinds of options with dealing with chronic pain.
So YavapaiHealth.com.
Yes.
Great resource. Just another thing in the way of advertisement. I think we have a Dump the Drugs Day coming up. I think.
That is true. Do we still have
Yeah,
the flyer?
I don't
have it
have
with me.
have the information, but
MatForce.com.
MatForce, yeah, MatForce.org.
.org. Sorry.
And every police department in the county just about has a dispensary, not a dispensary, a place where you can dump unused drugs. And so
Right.
particularly prescription drugs, opioids in particular, get rid of them. Don't keep them
Safely and
around.
anonymously. So.
Yeah. Come and dump them. They get rid of them the most effective way.
That's right.
Kristin, Stephen, thank you for your time.
Thank you
Great
for having
message.
us.
Appreciate having you. Come back again and join us on Inside Cottonwood.